So with the surgical consent, I have to tell you that pretty much everything we do in plastic surgery is elective surgery, which means it's optional. It's not life-saving surgery. You could live without the surgery. You're doing this for a lifestyle modification or enhancement. So this surgery has risks that you need to be aware of, okay? So for example, if you're getting a surgery that has an implant, for example, you have to remember that an implant is a foreign body, okay? So breast implants, for example, they were approved in 2006 to be used in women 22 or older for breast augmentation, okay? Now, if you're 21, that doesn't mean we can't do your surgery. It just means that it's considered off-label use because silicone breast implants were only tested in women 22 and older by the FDA. But I do that all the time, and you just have to know that the data that we have is from myself, not from the FDA, okay? So let's talk about implants, for example. If you're getting an implant, remember that again, you got to read your consent form, but an implant can rupture. It can move somewhere you don't want it to. It can harden because scar tissue can form around an implant. It can get an infection. If God forbid you get an infection of an implant, it doesn't have its own blood supply, which means that you could take antibiotics. Like this mouse here, if I'm taking antibiotics and hold it in my hand, it doesn't clean the bacteria off of it. So we would have to remove your implant and wait 3 months to put a new one in. And unfortunately, there are some extra costs associated with that. So with implants, you can get infection, you can get malposition, they can rupture, and there's also a rare disease called anaplastic large cell lymphoma, which is a very rare disease. Luckily, if you ever get it, most people who get it, like they would just see like one side of their breast really expand. This would be like 6 years, 7 years later. But that has been found in today's literature to be associated with textured implants. And the risk with the textured implants that we use is about 1 in 100,000. So it's really low, okay? Your chance of winning the lottery is way higher, but we just have to let you know about that. Most of my patients get smooth implants. So most of you don't even have any risk for that disease. So just something to talk about. Also, any surgery you get, whether you're getting your tonsils removed or a hernia repair, there's risks of infection, okay? Bleeding. Bleeding is the most common thing that happens after any surgery. Now in plastic surgery, it's not like the kind of bleeding where you might need a blood transfusion. Most of the time it's just this, like let's say you're getting your breast done, this area is raw, okay? And if you cough really hard or you get really mad or you scream real loud because you're cheering for your favorite basketball team, woo, you know, or you're lifting weights, anything that increases your blood pressure or heart rate can make the little blood vessels that are underneath here start squirting out blood, and then it can expand. And blood, unfortunately, can cause nidus for infection. You know, bacteria feed off of the blood. Also, if you get enough blood under there, it can kill the skin. So we don't want you to bleed, okay? And that's also one of the reasons why we tell people not to work out for 1 month, because when you lift weights or run, you're going to increase your heart rate and blood pressure, you can bleed. And also, we tell people no sex for 2 weeks. The reason is that during sex, one of you is going to get excited. Your heart rate can go up, your blood pressure can go up, or someone might get a little aggressive or physical, and you might get trauma to the area and you can start bleeding, okay? We don't want you to have problems. So the risks, again, infection, bleeding. Anywhere we cut you, you're gonna have a scar. So you're gonna have scars, okay? You could have pain, okay? You're gonna have asymmetry. Nobody's built perfectly symmetrical, okay? I tell people, like, for their breasts, they're sisters, not twins, okay? And also, in the beginning, when you operate on someone, you get a lot of swelling, okay, and contour deformities. It's normal, like if you're getting your breast done, that like the two sides will heal independently of each other. One side might be a little higher than the other, okay, or stick out a little bit more. That's pretty normal, okay? And so anyhow, when you put an implant, for example, under the muscle stretches, and then the reflex is to contract, so it pushes the implants up and they look weird. In addition to that, you get soft tissue swelling. For example, if I do eyebrow surgery, your lower eyelids may get swollen because you live on Earth and gravity pulls the swelling down. So I had a lady, for example, I did liposuction on her abdomen and her genitalia were swollen. I didn't touch her genitalia, but the thing is that the gravity pulls the swelling down. People will be swollen and have contour abnormalities for about 3 months, okay? And now again, every day it starts to look better, but you have to be patient, okay? So you could get bruising, okay? Also, you may have All the sutures I use are pretty much absorbable. They're all on the inside of the body. But sometimes on my thin patients, the suture's underneath the skin and then it pops through. Okay? And those sutures, you would just call my office and we would remove those in the office. Okay? So, infection, bleeding, scarring, pain, asymmetry, contour deformities, bruising, sutures opening up. Those are all normal. Okay? Those are the like more routine things that can happen. Okay? I expect you not to use anything inhalable, and don't be smoking. Don't use anything that's inhalable. Don't use any nicotine. Don't vape. Don't put on any nicotine patches. Those can all inhibit wound healing. And if you're getting a breast lift where your incision comes together as a T, you could get a little opening like that big. But if you're smoking, it could be like that big, okay? And that's hard to fix. So please, no smoking. And also, if you're getting a lift of any kind, please avoid caffeine for 2 weeks, okay, after surgery. All right, so those are like the more routine things that can happen. Again, they're still very rare. The more serious things that can happen with plastic surgery are, for example, you could get a blood clot, okay? And then the blood clot could travel, go to your lung and block the passageway between your heart and lung and kill you. That's called a pulmonary embolism, okay? The risk for that goes up with surgeries over 10 hours. What we do to help prevent blood clots is we have the surgery center put these stockings on your legs that squeeze your legs, because your legs are the farthest point from your heart, and they basically keep the blood circulating while you're surgically asleep. Now, after surgery, remember, you're not just going to lay in bed all day. I mean, I want you to rest and take it easy, but literally going from laying down to standing up, you're going to make the muscles in your legs move, and it makes the blood move so it doesn't form clots. And as long as you do that 4 or 5 times a day, you're not going to get clots. Because, again, you're not going to pee in your bed. You're not going to eat a sandwich in your bed. So you got to get up to go to the kitchen to eat food. You got to go to the bathroom several times a day to go pee or have a bowel movement. So, again, that's the most common serious thing that can happen after surgery. But also, there's always a chance for a heart attack, blood clot, even, stroke, or even dying, right? But again, the risks of those things are low. I've trained my whole life to try to make surgery as safe as I can for you, because I care about you. I want my patients all to do well. And, I give you all my cell phone number so that, I can be available to help you guys as soon as anything is needed. But again, I expect good things to happen. Happy people get happy surgery, okay? So that's that part of everything. Also, just other precautions. If you have breast implants, don't ever pierce your nipples. You should still be able to breastfeed. They did a study where they looked at 150 women around there between the ages of 20 and 35 or so, and they followed them for 10 years. And none of them got breast implants, and they saw who got pregnant, who could breastfeed. And then they followed another 150 women in the same age group who got breast implants, and they found that the same proportion could breastfeed. Also, very importantly, if you're on birth control, remember, it's not as reliable for a month, because after surgery, you've already had anesthesia, you're getting pain medicines, you're getting antibiotics. So still take your birth control like you normally do, but just remember that you can get pregnant, because like some of those drugs can decrease the efficacy of your birth control for about a month, okay? So just be careful. Also, I tell my patients not to submerge in an ocean, swimming pool, river, swamp. Just don't submerge. Don't have water in a tub. You could shower and have water hit you everywhere. That's fine, because there's not a lot of pressure with that, okay? So anyhow, those are kind of the precautions. Also, don't use tanning beds. They thin your skin. Your chance of skin cancer goes up. But also, your scars should be protected from the sun for a year after surgery, okay? So if you're going to go out in the sun, spray your whole body with SPF 50, then put your bathing suit on, preferably something with UV filters in it, because there are bathing suits that have UV protection built into them, okay? Let me see if there's anything else I need to go over with you guys. That's basically it, okay? The other thing is we get you cosmetic surgery insurance to help offset any costs for any unforeseen emergencies. For example, if you get a bad infection, you need to go to the hospital, and you have to be admitted or something, which I hope never happens. But if it did, the cosmetic surgery insurance covers that for about $5,000 a day. Now remember, hospital bills can be more than that, so you might have to pay the difference. If you get a bleed or you have to go back to the operating room, For the first 45 days, that cosmetic surgery insurance covers you for stuff like that. Lastly, I'm not God. I'm just a good old simple plastic surgeon. I just do good, safe techniques, and I try to take good care of you, but I can't control wound healing. I can't control what goes on in your house, and I try to explain things as best I can. So if you have questions, please ask me or my staff, okay? Thank you very much for the opportunity. I'm really excited to get your surgery done, okay? Thank you. Bye-bye.